What is up, guys? Welcome back to my channel. If you have not seen already, I did start a series going over every single course that I had while I was in dental hygiene school, and I'm going through my notebooks, my note cards, my books, everything, and showing you exactly how I studied and got through each course, as well as any tips and tricks that I have that I use that I can share with you along the way. In today's video, we're going to be going over the second episode in my series called Studying for Dental Hygiene. And in this episode, we are going to be going over community dental health. So like usual, I have a binder for the subject. And I have written if it was a dental hygiene course, which it was, the name of the course and the course number. I had two different courses for this class. So the book that I had for this class I actually sold when I got out of dental hygiene school. So when I got out of dental hygiene school, I sold quite a few of my books that I knew I wasn't really ever going to look through again, and this was one of them. Also, the note cards that I had for this class, I really didn't use a whole lot just because this wasn't like a real note card type of class, which I will explain more in just a second. But the note cards that I have for this class are literally at the complete bottom of the box that I have for note cards, and we literally have a showing of our apartment today and we are moving in 3 days. So I don't have a lot of time to make a big mess and try to clean it up, so I would just be going over my binder for this subject. So community dental health is basically exactly what it sounds like. So it's talking about getting care to the public and working in settings other than the typical private practice setting or in the corporate practice setting. It's different types of things that we can do as dental hygienists and how we're able to give back to the community. So like usual, I have color-coded tabs for all of the chapters that we went over, of course in rainbow order, so that it's easier for me to flip through everything. And if I did have my book still and my note cards, I would have all of the note cards and the chapters of the book color-coded with the color of the tab as well. So public health is the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. So if you didn't know, the #1 chronic childhood disease in the United States is caries, which also means cavities. Cavities are extremely common, but they are also preventable and they're also transmissible. So ways that we get data is basically through the patient, which is the community, surveying them, analyzing things, planning for a program, implementing that program, budgeting and financing for the program, and actually evaluating how the program is working. So for every chapter in this course, I went through everything and I basically outlined all the most important information, writing everything down so that way I saw it in color, I physically wrote it down, I was looking at it, and it was easier for me to get organized to study. So we're talking about community dental health. We're talking about the 3 different types of prevention. So primary prevention is basically how to stall the disease, how to arrest the progress before treatment ever becomes necessary, and an example of that is just basic oral hygiene. So brushing your teeth, flossing your teeth, doing mouthwash, taking care of them, making healthy choices. And then secondary prevention is basically how do we terminate the start of disease or prevent it from getting any worse so that they would need any restorative work done, and an example of that is fluoride treatments or periodontal debridement, so special types of cleanings that we can do to prevent the progression of disease. And then tertiary prevention basically employs the strategies to replace what is lost. So at this point, it is too late to prevent anything, to stop anything. Only option that we have now is to fix the issue. So then we're looking at restorative dentistry. An And if I had the book, this is actually what my book looked like. Here's another fun fact for you. So dental hygiene is the only profession that's 100% prevention. And here are some ways that we can prevent issues within the public. So dental hygiene treatment, community water fluoridation. That's how we can reach a ton of people very quickly, very easily. Dental sealants, sealing people's teeth as soon as they erupt so they never have a chance to even get exposed to anything. Using xylitol. Xylitol is a natural sweetener that is proven to kill the bacteria that causes cavities. Any alternate restorative treatments, nutritional counseling, athletic mouth guards, whenever people wear mouth guards when they're playing contact sports, and of course mass education. So doing seminars, doing any public health presentations. Another fun fact, the optimal fluoride levels recommended by the U.S. Public Health Service is 1.2 to 0.7. Nice thing about water fluoridation is that not only is it one way to reach a lot of people very fast and very easily, it works systemically and topically. So systemic effects, it's absorbed via the blood plasma and it becomes incorporated into the structure of the teeth, so whenever the teeth are actually developing. And on the other hand, it's in the fluoride toothpaste, it's in the mouth rinses, it's in the gels that we use, it's in the varnishes that we use, so that way that's nothing that's being systemically ingested in the body, but your teeth are still able to get the benefits from it because it's topically being placed. Typically in a warmer climate, less fluoride is needed in the water systems because people are drinking more water. And then even for bottled water that doesn't contain fluoride is also an issue. So these are all the notes that I wrote down from the second chapter. Talking about tobacco use is a huge one because the 5-year survival rate is about 50%. So doing oral cancer screenings is a huge must for us, and I actually even tell my patients who do use tobacco to do them at home on themselves as well, because if we're only seeing them, maybe twice a year, we definitely could miss something in between. And here are my notes for the third chapter. So here's another fun fact. Research has associated periodontal disease with heart, lung, and a number of other systemic diseases such as diabetes and premature low birth weight babies. Periodontal disease, gum disease is associated with a lot of health issues. So if we were out doing public health screenings, there is a certain formula that we would follow, and that is the Community Periodontal Index. So we would score the patient from 0 to 4 based on what we found. So as a dental hygienist licensed in the United States, we are able to work in any of the states as well as anywhere in the world in other countries. Sometimes there are other tests and courses that we have to take to completely be able to do that. But something to note is that there are 7 countries in Europe that still report having no or very few dental hygienists. So we are able to work in, like I said, several different settings aside from the standard private practice or in a corporate office, and we're able to work on military bases, we're able to work in different countries, we're able to work in a community setting, we're able to work at a hospital, we're able to work in schools, we're able to work in a lot of places. And there's actually something called a public health dental hygiene practitioner, which I very highly considered becoming when I was in dental hygiene school, but obviously I never did. Basically, that allows you more opportunity to work in different places. So Australia and UK students will actually graduate with both a dental hygiene and a dental hygiene therapy degree. So that is really cool for them. And the Netherlands, dental hygienists can restore primary caries. A third of all dental hygienists in Netherlands have their own practice. They have the highest percentage worldwide. That is so freaking cool. Another thing, a lot of you guys will ask this in the comments, and you'll ask me my opinion of male dental hygienists. Dental hygiene is 98% female dominated. I think that anyone of color or any other nationality or a male that wants to become a dental hygienist is an excellent idea. It is definitely becoming more normal to see that. The average number of dental visits per person per year is about 2.5. The largest dental insurance in the United States is Delta Dental. So while we were in this course, we had to go out into the public and do a lot of presentations to nursing homes or middle schools, elementary schools, kindergartens, preschools, just different places, and teach them about oral hygiene or different ways that they can, get dental care. And one thing that we had to learn was how to teach for every type of learner. So not everyone is a visual learner. Not everyone learns just by listening. Not everyone learns just by writing. So you had to be able to teach people in several different ways so that everyone was able to remember what you were trying to teach them. So we would spend Fridays, we would spend days during the week, we would go on weekends, and we would go and give presentations to all these random people. So we'd have a lot of outlines written down, based on the age group or whoever we were talking to, and we would have a ton of visual aids. So we'd have little activities for them to do, we would have pictures, we would have games, we would have all sorts of fun things to do to keep them interacted and interested in what we were actually trying to teach them. So basically just knowing who your audience is. Is it a hospice worker? Is it a healthcare worker? Is it a family caregiver? Is it a school teacher, a social worker? Are we dealing with prenatal? Are we dealing with infancy? Are we dealing with teenagers? Are we dealing with older adults? Are we dealing with inmates? Are we dealing with people living in poverty? People with hearing impairments? People with arthritis who have issues being able to hold a toothbrush? We have to have different ways to show them how to care for their teeth. What are the barriers that we have to overcome? And on top of all that, you have to be mindful of people's different cultural beliefs and, be respectful of that. People are not always going to think the same way that you do or believe the same things that you believe, and your job is not to force what you think on them. It is to respect their opinion and beliefs and simply explain why you feel the way that you do, and what someone does with that information is completely on them. The dental workforce is the least diverse of all health professions. Again, talking about female white dominated. We need more diversity in our work field. We had a lot of different indexes for basically assessing all the patients. And certain places want certain indexes, certain countries use certain indexes. We also had to learn how to read research. Was it just a short, simple survey? Was it a case study? Was it a developmental thing where they're following people for literally years? Was it a cross-sectional study? So it's something over a short period of time. Was it a small group? Was it a large population? All these things make a big difference whenever you are analyzing and reading research. Quantitative data deals with numbers. So there's an N in quantitative and there's an N in numbers. So that's talking about the counts, the percentages, the means. Qualitative data deals with the quality. So there's no N in here, so you know that N and N go together and qual go together. So that cannot be expressed numerically. So ideally, of course, we want research that is independent and not something that is affiliated with someone else, so it's more reliable, it's not biased. But they do have to say whether they are affiliated with a company or not whenever you're reading research, so make sure that you always look for that. So I guess that turned out to be more informational and educational than giving you helpful hints. Like I said, this is a very different type of course that you take because you're learning how to teach other people and you're going out in the public, and and you're learning how to read, research, and collect data and be able to deliver care and education to several different types of people and populations, and just talking about the different areas that, you know, we as hygienists are able to work in. So I hope that this was still helpful for you guys. Again, if you have taken this course before, please let me know any tips or comments that you have about the course in the comment section down below so that it is helpful for anyone else who is watching. If you have not already, please make sure that you hit the subscribe button so that you do not miss any of the videos that I will be posting in this series. If you enjoyed this video, please make sure that you hit the like button, and as always, I will see you guys in my next video. Thank you so much for watching. Bye guys!